Welcome. This presentation is brought to you by Elisabeth Dilling, Rachel Egelhof, Hannah Vanek, and Meredith Vlach. During this presentation, we will discuss 3 different breastfeeding campaigns, the theories they use, and how effective these campaigns are in their mission. The importance of breastfeeding is well documented and provides multiple health protective benefits for both mother and infant. However, among births in 2007, only 75% of new mothers initiated breastfeeding, 43% of mothers continued to breastfeed at 6 months, and only 22% of mothers breastfed at 12 months. Studies have shown that in the United States, women who choose to breastfeed are more likely to be middle income, white, and employed. Breastfeeding rates among Black infants are almost 50% lower at birth than those of white infants, necessitating targeted promotion of breastfeeding among lower income, non-white, and unemployed mothers. Breastfeeding is recommended as the sole source of infant nutrition for the first 6 months of life and provides crucial protective benefits during infancy and throughout childhood. Children breastfed exclusively for at least 6 months have higher cognitive and neurological outcomes, a lower risk of illness and infection, lower rates of obesity and diabetes, decreased cardiovascular and metabolic disease, and increased maternal bonding. Maternal benefits are also well documented in breastfeeding research. Immediate benefits for the mother can include postpartum weight loss, increased bonding and lactational amenorrhea. Long-term benefits may include diabetes, metabolic and cardiovascular protection, and a decrease in reproductive cancers. In addition to health benefits, for most mothers, breastfeeding is much less expensive and more accessible than infant formula.
Despite efforts in breastfeeding promotion throughout the early 2000s, a gap in breastfeeding rates between white women and African American women persists. Lower breastfeeding rates are also associated with lower socioeconomic status, return to employment directly after giving birth, limited education, little social or family support, and opposing cultural attitudes. An example of an excellent breastfeeding campaign is Babies Were Born to Breastfeed. This campaign was launched in 2004 by the Office on Women's Health, OWH. The successful health promotion campaign used print ads, television, radio, and billboards to increase awareness of messages about breastfeeding. At the conclusion of the campaign, the number of women correctly identifying 6 months as the recommended breastfeeding duration and the number of women agreeing that babies should be exclusively breastfed for the 6 months had increased. 73% of women surveyed reported that they had breastfed a child, compared to 63% at the beginning of the study. An example of an average breastfeeding campaign is Learn Together, Grow Together. This 3-year program launched in 2018 by the U.S. Department of Agriculture, Food and Nutrition Service, Special Supplemental Nutrition Program for Women, Infants, and Children. It targets mothers in their first 6 weeks postpartum and in late pregnancy. This 3-year campaign utilizes social media, a buddy program, educational materials, and a counseling program to teach the target audience. An example of a poor health promotion campaign is the Breast is Best campaign, sponsored by the U.S. Department of Health and Human Services and the Ad Council. This campaign faced severe criticism for inconsistent research, capitalizing on the public misunderstanding of risk and identifying infant nutrition as the matter of danger versus safety. The study failed to address social, structural, and employment conditions of the population, leading to an ineffective campaign.
Each of the chosen health promotion programs included elements of different theoretical frameworks. Born to Breastfed include the main construct of the health behavior model, self-efficacy, benefits to action, and cues to action. Born to Breastfeed educates mothers on the benefits associated with breastfeeding, along with urging mothers to breastfeed to promote the health of their children. The second program, Learn to Grow, has elements from the trans-theoretical model. Learn Together, Grow Together promotes a stage-based approach of breastfeeding, which include the stages of learning about breastfeeding, starting breastfeeding, overcoming challenges, and thriving. This intervention also provides a support system connecting other breastfeeding mothers, fathers, and grandparents. Constructs from the trans-theoretical model are used: stages of change, conscious raising, helping relations, and social liberation. Breast is Best used fear and risk as key concepts. This is related to the extended parallel process model and the elements of risk susceptibility and risk severity. This program also uses constructs from the theory of planned behavior. One of the program's goals is to make the action of breastfeeding, especially in public spaces, a positive act and considered a sociative norm. From the theories studied over the past several weeks in this class, one of the best that lends itself to the development of an effective breastfeeding campaign is the social cognitive theory. Social cognitive theory covers many aspects of cognition and learning, with a focus on self-efficacy, outcome expectations, social structural factors that would be appropriate to effectively increase the rate of breastfeeding in a community. Based on the social cognitive theory framework, a campaign to promote breastfeeding to a specific target audience should contain messages to increase knowledge and perceived self-efficacy. Breastfeeding moms who lack confidence or have low self-efficacy in their ability to breastfeed are significantly more likely to stop breastfeeding within 2 weeks of giving birth than those who have higher self-efficacy. Potential breastfeeding moms seeing other moms in their peer group breastfeeding or modeling the behavior is an effective way to increase perceived self-efficacy. Research has shown that peer and social support can effectively increase a breastfeeding mom's self-efficacy. According to the social cognitive theory, the use of verbal persuasion along with vicarious experiences can increase perceived self-efficacy as well. However, an increase in knowledge and perceived self-efficacy alone is not always enough to increase the adoption of a behavior, so a campaign should also focus on outcome expectations. The positive outcomes from breastfeeding must be acknowledged in order to promote breastfeeding. Finally, the social cognitive theory framework takes into consideration socio-structural factors for the target audience. This construct is a prime reason why the social cognitive theory lends itself to the development of an effective breastfeeding campaign. When developing a campaign with the social cognitive theory framework, this is a key construct to analyze. How do the cultural and physical environments play roles in a woman choosing to breastfeed? The impact of negative social and cultural attitudes along with unqualified healthcare professionals or lack of support from healthcare professionals, when coupled with lack of confidence and poor self-efficacy, can all have an effect on breastfeeding behaviors. Not only does a negative environment have an effect on breastfeeding behavior, but research has shown that knowledge and high self-efficacy, along with positive attitudes and influences toward breastfeeding from a partner and/or a peer group, can also affect breastfeeding behavior by encouraging resilient self-efficacy. Breastfeeding is a complicated behavior in which evidence suggests that not only knowledge and self-efficacy play a role in behavior choices, but the environment impacts this behavior as well. The framework of the social cognitive theory allows a campaign to address each of these areas in order to promote and market breastfeeding effectively.
When designing health promotion campaigns to promote breastfeeding among new mothers, the use of social marketing is considered an effective tool. Social marketing campaigns aim to promote behavioral change through interventions based in theoretical framework. Social marketing campaigns are designed for target audiences such as pre- and postnatal mothers. Using a social marketing campaign as an intervention in new mothers revealed higher levels of social support, increased self-efficacy, and higher outcome expectations for their children. One effective use of the social cognitive theory framework in promoting breastfeeding is through social media outlets such as Facebook. One recent study found that online social media communities increase self-efficacy and evidence-based knowledge for breastfeeding moms along with providing potential for them to achieve their goals. The use of these outlets may provide a communication channel for the promotion of a breastfeeding campaign based on the framework of social cognitive theory. A couple health campaign examples that were utilized with the social marketing was the Loving Support Program, which was the USDA's national program through the Special Supplemental Nutrition Program for Women, Infant, and Children, also known as WIC, which aims to design a national breastfeeding promotion campaign. Loving Support distinguishes breastfeeding as the preferred option for infant nutrition, provides support to breastfeeding mothers and their partners, increases community acceptance, and normalizes breastfeeding among women. Another program, Mother Friendly Worksite Program, was implemented by the Texas Department State of Health. This campaign aimed to educate employers about mother-friendly policies focused on breastfeeding in the workplace. Fathers Supporting Breastfeeding is a social marketing campaign that used multimedia tools as a resource for providing education to African American fathers. The goal of education for African American fathers was so these fathers could serve as a helpful support system for mothers and increase breastfeeding rates in African American women. Lastly, Best for Babes, Champions for Moms is a program that aims to provide encouragement to pre- and postnatal mothers through hearing other women's experiences with breastfeeding. Women who have breastfed or are currently breastfeeding share their barriers, success stories, and how they have adapted since initial initiation of breastfeeding their infants. An overview of the promotion of breastfeeding is the interventions and health communication campaigns that promote breastfeeding among new mothers are essential to increase awareness, social supports, and self-efficacy. The promotion of breastfeeding provides important knowledge and information on the benefits for mothers and infants on topics such as infant nutrition, early childhood development, and overall health benefits for mothers and infants associated with breastfeeding. Social cognitive theory is an effective theoretical framework for the promotion of breastfeeding. Increasing social cognitive theory constructs results in an increase of breastfeeding in the community. The use of social marketing campaigns when designing intervention campaigns resulted in higher levels of social support, increased self-efficacy, and increased community awareness.